So what is MS? A few explanations or a few sort of angles you have already been given this morning. There was an immunological one and a pathological one. So this is the clinical or epidemiological take on it. It's a very common condition. It starts early, so 70% between the age of 20 and 40. It's more women than men that get this condition. It's quite disabling for many. About 1/3 actually get on very well with it. But after 10 years, about 1/3 of all patients with MS have to use a wheelchair, and after 15 years, that increases to a half. And this is the reason why we're all here and what this operation in our group is all about, really. So in other words, it's the most common cause of chronic neurological disability in young adults. Moving on from that, what is MRI? Well, this is a machine, and I'm sure some or many of you have actually seen one or even been lying in one of them. But what is actually happening in it is that we consist mainly of water, and one of these protons of water is actually here, and it's spinning. It's not really, it's spinning and it's wobbling, so in about that movement, and pretty fast, so it depends on the field strength of the magnet. In the usual systems, 1.5 Tesla that most of you, if you've been in one, have used. It's about 64 megahertz. So it's like a spinning top, just faster. And in that magnetic field, when we're brought into it, we're actually aligning our own little magnets, our protons, to that magnetic field and become ourselves, in a sense, a magnet. And we can't use that magnetization yet unless to produce a picture, unless we do something about it, and that is pushing all these protons out of alignment, and then so switch on a radio wave, and then switch it off, and then see the signal or obtain the signal that comes out of it, and that is the T1 relaxation and the T2 relaxation. And as this is all very complex, complicated, I'd say we all stand up, those who can, and stretch a bit. So we all stand up. And lift your arms up. Okay. So very good. So if you're safe and sort of bend over, okay, like this. Excellent. Come slowly back. So that's T1. Okay. And now stretch your arms like this. Take care of your neighbors, right? Okay, and if you turn like this around, so that's T2, okay? So we've covered that. Excellent, very good. So that gives you a broad idea of this slightly more complicated physical phenomenon.